As the coronavirus COVID-19 continues to ravage all countries, the Salesians African Great Lakes Vice Province was not left behind by this deadly virus. In our province, Rwanda was the first country to register its first case and was followed by Uganda. Until today, March the 26th, Burundi has no confirmed case of COVID-19. The situation is complicated in our province, where Rwanda is in a total lockdown while Uganda is in partial lockdown, and Burundi, the poorest country of our province, is at alert with risks to not be spared out by the virus.
We are in a bad situation because through the measures taken by the government as Salesians who are involved in education and apostolic work, we are mostly affected also because the government take the measures of closing the schools recently, to close the churches, to close where many people can gather, like in sport. It means our oratories are affected. To close the place where people meet to celebrate feasts, the weddings, the burial ceremony. All those activities are prohibited in Rwanda today.
The virus has caused negative impacts on the Salesian works in this province. In Rwanda and Uganda, for instance, no oratory services, schools have closed, churches also closed, and a big number of poor citizens are expected to face hunger and lack of other necessities. For instance, here in Rwanda, all businesses are almost closed except food shops and other essential services like hospitals.
Business were all exempt from the restriction. A temporary ban was put on non-essential travel between different cities and districts across the country, while all employees in the public and private sectors work from home.
We are trying to put in practice what the government is asking us as a Salesian, and we have in mind as a province, especially in Rwanda, Uganda, and Burundi, to make awareness of this pandemic, because many people do not know what is coronavirus. It is passing through the news, but they don't have enough knowledge about this virus. We would like to do something on the side of cleanliness in our oratories, school, and the parishes, where facilities are poor, where we don't have water, because when the place is dirty, the virus can take advantage to destroy everything.
According to our office in Palabok refugee camp, no case yet reported in the camp. Awareness campaigns on COVID-19 are taking place. There are high risks to refugees in case the virus arrived in the camp, as well as in case the support provided to refugees is missing.
Through the means, through the cooperation with our partners, in case we have financial means, we can help support the families, especially those families who have been working daily to gain their life, because until now people do not know where to get food, because if you don't have money, you don't earn money day after day as it was, it will be hard for the families.
As of March the 26th, Rwanda has so far the highest number of COVID-19 patients, which stands at 41 cases, followed by Uganda, which as of March the 26th, has 14 confirmed COVID-19 cases nationwide. Further international spread of the virus is expected. Drastic measures continue and citizens are urged to stay home. The situation is at standstill, especially in Rwanda and Uganda. Salesians continue to raising awareness on the virus in all communities by using all means of communication while planning ahead for the aftermath of the pandemic.